Good afternoon, everyone. Welcome to today's press conference for Friday, the 16th of October, 2020. Today we are recording. We're not going out live. We will, in about half an hour after the meeting ends, you should be able to upload the recording. So apologies for that, but it will be there in the fullness of time. Thank you very much to all our friends from the press for joining us. What we will do today is the same format as we normally do. So we go to Lucy Whiteman, the Director of Public Health, for her update on the weekly figures. Then we would go to Councillor Jonathan Nunn, the leader of Northamptonshire Borough Council, for his view on the politics of the situation at the moment. Then we will go to Councillor Tom Beattie as leader of Corby Borough Council for his views of the current week and so forth. We're joined today by quite a long list of people. As I say, we've got Lucy Whiteman, we've got Jonathan Nunn, and Martin Griffiths has joined us, Russell Roberts, Joe Watt from the CCGs, Simon Weldon from the CCGs, Becky Bradshaw from the University of Northamptonshire, Paul Andrews from Northamptonshire County Council, Richard Auger, the leader of Daventry District Council, and Ian McCord, the leader of South Northants Council. I think I've covered everyone in that. If I haven't, I do apologise. What we'll do, we'll go to Lucy first, then to, as I say, Jonathan, and then Tom Beattie, or vice versa. Then we'll come to the written questions which you've kindly submitted beforehand, as we normally do. Thank you very much. I will come to Lucy Whiteman, our Director of Public Health, straight away. Lucy.
Hi there, thanks very much, Councillor Morris. So obviously quite an interesting week. In the last week, we've seen the introduction of the new local alert levels by the Prime Minister. And obviously we have been placed within that process. So if we have a look at the slides, if we're able to bring them up. So these will come round to you later on, so apologies, as I'm sure you can appreciate, we have obviously been finalising them based on the local narrative. If we can just go back to the first slide, that would be good, thank you. So clearly, obviously, the key line here is that Northamptonshire as a whole has been placed in tier 1 of the government's COVID alert system. However, as you will see from the data, our case rate continues to rapidly increase. So we are imploring residents to remain sort of in adherence to the guidelines around level 1, but also the local recommendations about the additional measures that we feel we should be taking. So we are asking for people to strictly follow both the guidelines and the advice. Clearly, our case rates continue to steeply rise. And we need to be very aware of the fact that we could be obviously escalated, and we obviously have been seeing various discussions play out for different geographies over the last few days with regard to that. The majority of our positive cases continue to be driven by household transmission, and that is either between household members or between households. So again, we need to consider, just because you can do certain things at level 1, just, should you be doing those things, particularly when it comes to mixing households. So if we go on to the next slide, this obviously just outlines for the public the 3-tier COVID alert system. And again, we've provided a link there to that new guidance, and obviously just an outline of the key messages around the different alerts. And as I said, we've been put in tier 1, which is the medium risk tier. So if we move on. What we want to be clear about is that we have a concern about that mixing between households, and obviously half term is coming up. So we're asking mums and dads to be firm this half term, that we need to consider the risk that mixing households obviously provides or creates within Northamptonshire. And so we're saying, actually, can we think about using the half term holiday as a natural circuit breaker? Obviously, there's been lots of discussions nationally about this, but we are keen to see whether reducing the mixing between households will indeed impact on that transmission. So just because we are allowed to still mix in those households doesn't mean that we should. And therefore, if we don't mix, we are reducing the risk of spreading the virus between people. And if we act now and protect ourselves, our children, our parents, and the more vulnerable people in our communities by just adhering to those stricter restrictions and recommendations, then we may be able to avoid escalation to level 2 or even level 3. So during this half term, we're just encouraging people to meet outside and play in the park instead of private gardens. And obviously if not to mix households indoors at all, and certainly no sleepovers. We've definitely seen evidence of children having sleepovers being, the driving factor behind some of the school outbreaks. So we're utilising the local evidence to make these recommendations. If we move on. So we've got, again, as we always do, information for the public about changes. So here we've provided details of the financial support and the payments that the boroughs and districts are able to make for those people who find themselves having to self-isolate, either because they are a case or indeed because they're identified as a contact. And again, just links to all of the other government advice and guidance. And just a reminder really that we continue to look at the levels of compliance locally, and we work with our environmental health officers, the local marshals, the police, to make sure that obviously people are complying. These rules and restrictions are in place for a reason. We know that wearing a mask, that maintaining hand hygiene, that maintaining strict social distancing does indeed reduce the onward transmission of the virus. So where we see compliance failing, we will step in. So if we move down to the data, which is slide 8. So people will remember that last week we saw 417 cases. This week, as you can see, we've gone over the 6,000 mark from a point of view of our cumulative position, but worryingly, we've seen even more cases, 701 in the week up to the 11th of October. So the graph, speaks for itself. The data here speaks for itself. We are on a sharp increase, a sharp and steep trajectory. These are the patterns seen elsewhere where we've seen areas go into, much more severe restrictions, and therefore we are imploring people to act now to avoid that escalation. The next slide shows that, again, we've got difference in distribution. Although more divided equally across the two genders, we can still see that we've got a large group of young people who are being infected, some of that associated with outbreaks in schools and colleges, but not all. And clearly you can now see that also filtering through to the other age groups. There's quite an increase there. In the older age group, the 50 to 59-year-olds, and also the working age adults. So this reflects that transmission within households and between households. We're now seeing a much broader age range affected, and that is also translating into our older and more vulnerable people being exposed and unfortunately being admitted and to hospital and even passing away. So this is something, we must see the warning signs here. And we must ask people to therefore reflect on the restrictions and the recommendations that are currently in place at this level, but also that we're asking for people to follow locally. If we go on to the next slide. So this shows us, as we've done before, just the crude case rate, the crude case numbers. So 701 cases in Northamptonshire. Across the board, apart from East Northampton, we've seen an increase in the crude number of cases. Northampton, you can see there a real focal point for the number of cases. That's 244 in just 1 week. But some of the areas that historically have avoided some of those numbers, being up there in the high numbers, East Northamptonshire, despite it having a lower number than last week, still 74 cases. South Northamptonshire, 90. This is now very much a county-wide issue, and therefore this is a call to all residents, not those that were just affected by the Chief Medical Officer's watch list, but all residents to be considering whether, just because they can do something, should they be under these circumstances. The next slide shows this as a case rate, so we know that this allows us to compare different areas, and it makes the population size equal, so comparison is easier. So as a case rate per 100,000 population, as that rolling 7-day average, one of the key variables that the government uses to ascertain where different areas should be from a point of view of COVID alert levels. We can see Northampton there has obviously breached the 100 cases per 100,000 mark at 106 cases. Daventry, not very far behind, and all other areas having had quite a significant increase in the last week. Although we remain overall significantly lower than the England average, this is a stark warning. This is roughly where some of our sort of northwestern areas were 3-4 weeks ago. And you can see that steep trajectory, and it is extraordinarily worrying that we could indeed be following that trend. So the next slide just gives that pictorially. You can see that steep increase in the England average, and very sadly us following suit. So yes, although it looks like we've got some way to catch up we will if we don't start to take action. The next slide obviously just gives, as we have been doing for the last few weeks, a summary of the position of our schools and colleges. So at the moment we've got 10 active outbreaks in schools and colleges, and that's up to the 12th of October. We've got 38 cases associated with those outbreaks, 16 cases in the university as it stands. But obviously very pleased to say that despite some of these challenges and a slight increase in those numbers, we're managing to keep schools open. We've got a high level of pupils attending, and obviously schools continue to work with us, with Public Health England, to maintain a safe environment and mitigate those risks wherever they do appear. As I said, it's interesting that a lot of contact tracing information that we've been finding out by having that service locally has given us insight into the fact that, again, quite a lot of this spread is actually outside, and it's where children are socialising. So again, reinforcing those messages over half term, just because the current level allows us to mix. Really, should we? We can see the numbers going up here. We've seen the numbers go up steeply across the county elsewhere. We need to be considering our actions and the implications of them. So the next few slides start to obviously provide you with a summary, as we always do, about the areas most affected in the last 28 days. And this really does reflect the fact that we have got less sort of pockets of focused issues. This is much more equally spread, if we're able to move on a slide. You can see it's starting to be a sea of dark blue here. So where we had that more focused, higher population areas and higher deprivation areas more affected, you can see here it's starting to spread much more rapidly into our rural, more affluent areas. This is a Northamptonshire issue now, and therefore we have got to work collectively to make sure that we address the increasing spike. If we go down to outbreaks, which is slide 18, then again, you'll see some of what we've just talked about reflected here. So we've currently got 32 active outbreaks, so an increase, and associated with that are 123 cases. So it doesn't take a mathematician to work out that of those outbreaks, the average number of cases associated with those outbreaks is increasing. We're seeing less of the individual, 2 or 3 cases, and more outbreaks that have more cases associated to them. But as I said, interestingly, most of that spread is still happening within a social environment. They just happen to all be either educated in the same place or working in the same place. The one bit of this information that deviates slightly from those rules is the care home outbreaks. You can see we've got more here, and we've got more cases again associated with each of those care home outbreaks. And we're lucky to have that proactive swabbing, and it does pick up those asymptomatic cases, which is really key to making sure that we isolate people before they're able to spread the virus. But we are still seeing an increase in the number of residents and staff associated even with those care home outbreaks, which just is a reflection of the fact that we've got an increased community prevalence of this disease, and we need to make sure that we are, if we've got any symptoms at all, if we've been exposed in any way and we are told we are a potential contact, that we get tested and we isolate as soon as possible. And that isolation is away from any other family members as far as possible. So if we move down, obviously we continue to work with all of our partners to take action, particularly around comms and engagement, and equally now enforcement. We need to make sure that people are using the test and trace app so that as and when cases are identified, we're getting in contact with the people that they have potentially exposed themselves to and potentially could be infected, and making sure that they again isolate, they get testing. We have an abundance of testing capacity at the moment. There are no further issues around national lab availability, and we have availability in our test centres. So again, encouraging people, if they develop symptoms, if they have been exposed, then they need to get tested. We obviously at the moment as well continue to utilise all of the intelligence that we've got, and we are obviously having discussions locally about how we use that intelligence, how it shapes our decision making. And obviously the Oversight and Engagement Board that you chair, Councillor Morris, is key to that. So, we're working here now as a county and we come out with one voice. And that's why we're trying to make sure that the residents across Northamptonshire understand the messages that we're putting out today. This is no longer, an issue limited to certain boroughs and districts. The ongoing public health messaging, I think people will have seen some of the new graphics that we've got, reinforcing on the next slide some of the best ways to address the issue of COVID. So if you have symptoms, it's about making sure that you isolate as soon as possible, get that test, and obviously only leave home for that test, and then continue to isolate until you get your result. It talks about how you should be isolating within a room, as I said, away from other family members or household members wherever possible, stepping up cleaning regimes, and just taking sensible steps to avoid any potential contamination of anybody else in the community or within your family. On the next slide, again, we just give some of the summary of the actions that we're taking. And then at the end, obviously, again, provide some more of the information that we have been doing on a regular basis about access to support, and not only how you get tested, but also any information about where test centres are, and the key messages around sort of hands, face and space. What we've also included just at the end of the pack this week is there clearly is still some confusion, and I recognise that because it's not a simple system. If we go to partners working on the COVID-19 response slides, this talks a little just about what each of the agencies does and is responsible for over the next couple of slides, just to try and help the public understand what the role is of each of the different elements of the system. Because as we've talked about these tiers, people obviously have heard more about, for example, the Joint Biosecurity Centre, for example. So it's just giving people an idea about how all of those agencies work together in that decision-making process, and obviously how we take action locally and the role of each organisation. So I'm just hoping that's there for information and to help people navigate their way through what is quite a complex system.
Thank you very much, Lucy. Thank you for that. I'm going to come now straight away to Councillor Jonathan Nunn, the leader of Northampton Borough Council, and then I'll come to Tom Beattie, the leader of Corby Borough Council. Jonathan.
Yeah, sorry, I remuted. Thank you, Ian, and good afternoon, everybody. Well, what a dreadful situation we face. The phrase second wave came into our vocabulary some months ago, and I think this must be what it is, and it's turning out to be more of a tsunami. I think this is absolutely devastating to see these numbers grow. Some small consolation that it's consistent with national trends, but that is very little consolation at all, really. For me personally, I find it incredibly worrying, and it leaves us with the most rotten balancing act to try and perform. We're balancing as the top number one priority, health, clearly people's safety, people's health, and preservation of life. But of course, we're balancing that against economic considerations and people's jobs, and people's ability to pay their bills and maintain their property and everything else should not be sniffed at. And perhaps the third thing we're balancing is people's liberty, because how awful it is that we're not freely allowed to go to work in the normal way and do all the other things that are a part of an everyday fulfilling life, and frankly also, of course, contribute to us maintaining a reasonable level of mental health. More and more talk about that and the potential time bomb that's ticking. So as we balance health, economy and liberty, what we do know is, in order not for this to worsen, everybody has to follow the guidance and the precautions as every opportunity, 100% full compliance. And we talked about businesses. Let me say here now, I think businesses have got to be bold. if someone comes into your business, you should turn them away if they are not complying, because they represent a risk to your business being shut down. And people should stay away from businesses who are not complying, because they represent a risk to you and to your family and your loved ones. We at councils, we continue to send people out 7 days a week, round the clock, to guide businesses and actually also to enforce. And that's a really awful thing to have to do, particularly to a struggling business, but it is the right thing to do, because the public need to know that if they walk into a business in my town of Northampton or any other in the county, that they are being protected in the same way that we inspect kitchens to make sure they're protected from food poisoning. We must visit to check that they are complying with COVID regulations. And if they are not, sadly, we have to enforce. My promise to the people, certainly of my town of Northampton, is we will enforce if they are putting your health at risk, but we will guide at every opportunity. And certainly that's been the main thing that we've done so far. As Lucy said, we've seen the 3-tier system introduced now. I think there's some benefits to that. It brings certain clarity. You know, you have 3 templates, don't you? And you therefore have perhaps clearer opportunity to perhaps take away some of the fog that may have been on some of the detail. When detailed, regulations or guidance has come out, maybe it has been possible to say you haven't kept tabs. So we now have 3 templates that we follow. So I think that brings some clarity. It helps people identify the level of risk and the guidance prevailing in their own area, and possibly also, some choices over travel that they may have to consider as part of their work or even for social reasons. Personally, I feel reasonably happy with these. You can never find a perfect system, but I think that's right. And given the fact that we are in tier 1, is that right? There is a danger of complacency. We've talked before about this when we have come up and down the previous rating system. We have to accept we are where we are. But I tell you one thing, I think the way numbers are going, it is virtually inevitable that we move to tier 2. We have no information on that. We have no decisions on that. But on current trajectory, the one thing that will stop us is the most overwhelming efforts by businesses and residents to start following precautions, guidance, and so on. And as Lucy says, all of these things are not a limit to which we should live. They're the limit towards which we might go. But actually, you're far better, you're far safer if you say well within them, and you decide that you're not taking the opportunity to do this, that, and the other, all of the things that we do currently have, because abuse or overuse of the liberties we're currently allowed will see them removed. And the one big value, in my view, of this clear 3-tier system, I look a bit at what the guidelines are for us, of course, but I spend more of my time looking at what the restrictions would be in level 2 and 3, because that's where we certainly can't be. Now, of course, in terms of what others may be doing, COVID Oversight Board, which Ian chairs this morning, spent a long time considering what should our next move be. We look at places such as Essex, who have decided that they should be seeking to upgrade the level in which they sit. And that's understandable, actually. Many of us might have expected perhaps we would have been put in tier 2 and we would have had to just deal with that. And it is that real balancing act of health, which is our primary concern, preservation of life, balancing the economy and balancing liberty. I have to say the overall conclusion of that board, many of whom you see on the screen here now, is that we will not actually seek to be put up a further level. We will make sure that everybody is fully aware of that huge risk that exists, that we could so easily be put by the government into that higher level. So the overall message, I think, there is we are not seeking to go up a level, but we are asking businesses, residents, and everybody to do everything they can to seek that we are not forced to go up a level. And that's the position at the moment. Ian, I think that's most of what I have to say at the moment, and happy to come in and answer questions later. Thank you.
Thank you very much, Jonathan. And I think we all echo those comments, definitely. I'm going to bring Tom Beattie in now, who's the leader of Corby Borough Council. Tom, I'm sure you echo those as well, but adding to that message. Thank you, Tom.
Yes, thank you, Ian. I mean, once again, following Jonathan, I reiterate everything that he's said, and just the upward trend clearly is very worrying. I draw some comfort from the fact that just a couple of weeks ago, Corby was on the government watch list, and we managed to get ourselves off that watch list, as indeed did Northampton Borough, which shows that if the guidance and the instructions that we have in place for people, if they're followed, we can do that. And I think we need to continue to ensure that there isn't complacency sets in. Being in tier one, clearly it's much better than being in tier two. But if the upward trajectory continues, that's where we could end up. I mean, whether the three-tier system is the best and most effective way of dealing with this across the nation remains to be seen. We're in the early days of that, but I'm prepared to give that a chance to see if it works. Lucy has indicated earlier that the problem appears to be transmission both within households and between households. And I think her advice about that sort of intra-household transmission as we approach half term is extremely important. And whilst we're not telling people to do certain things, that doesn't mean to say that they should do them. I think that's clear, that we want people to act sensibly and follow the advice and guidance. And I think we've demonstrated that where that happens, we can make a difference. You know, we here in Corby, we continue to work closely with our local businesses. We continue to work closely with our local schools and the community in general, trying to get that message across. We haven't yet had to enforce that message, thankfully, although we have issued a number of notices, a number of notices to businesses to comply, following social distancing rules, who perhaps haven't conducted a risk assessment, who are not enforcing the wearing of masks. The next step on that, of course, is enforcement and is fines. And as Jonathan said earlier, we don't want to have to be in that position, but we will be if we see this upward trend continue. So it's a worry. We saw this last week with the figures that Lucy presented to us, which showed a sharp spike, which I don't suppose came as a huge surprise, given what's happening across the country generally. I think I made the comment last week that we in Northamptonshire are not immune to that, and that spike is catching up with us. I think that there is a view that you know, if it continues on this upward trend, then of course we need to move into a new tier, which allows us to impose stricter regulations to try and get on top of that. But that's reviewed on a weekly basis, and I'm sure that our colleagues in public health will advise and will discuss with government about where we are with that. I mean, obviously, if that doesn't improve, then it's up to the government. I mean, the government could themselves make a decision to move us out of where we currently are to where they think we need to be. At the moment, that's not the case. That continues to provide some comfort, I think, that we can continue to you know, put up with these restrictions on our daily life. I know the frustrations that people feel as people go about their daily lives. Jonathan has articulated them very well. It's a balance here between ensuring that public health is protected, that lives are protected, but that the economy also is protected, that we don't move into a situation where we're facing huge job losses and the associated problems that will bring with it. So getting that balance right is not easy. And I think there's also the restrictions on our personal freedom, which none of us welcome. People want to go about their business as, you know, as unaffected by what would appear to be, you know, regulations imposed upon them. That's never welcome, and it's never something that people are happy with. And I can understand that frustration, but I would urge people to bear with this. We have to get on top of this. We have to make sure that that a level of infections doesn't increase to such a time where we move into one of these higher tiers where life will become much more difficult than it currently is. And I think that's what we need to avoid. I would just, reiterate the messages I've been giving along with Jonathan for the last few weeks about let's not become complacent. Let's ensure that these rules and regulations are in place to ensure people's health and well-being, and let's stick to them. I think that's about as much as I need to say. I'm happy, I'd like Jonathan to answer any questions if there are any.
Thank you very much, Tom and Jonathan. Very sobering words, and I think words that we must all take very, very seriously going forward. I'm going to move now to the questions that were submitted, some of which I feel may now actually have been answered during the opening statements, etc. But I'm going to come to Stuart Radcliffe. Stuart, you did have a question, but I feel that may have been answered, but I'll give you the chance to answer another one. Stuart, are you there?
Yeah, Councillor Nunn made it very clear that you weren't going to ask to be put into tier 2, but I just wondered at what point would we need to reach for that decision to be looked at again, and at what point would the government look at us being moved into tier 2?
Thank you. I'll allow Jonathan to answer that one since you directed it at him. Jonathan.
Yeah, thank you. Thank you, Stuart. A really important question, of course. So from the point of view of the board that meets, we meet weekly, and it'll be every week, and that gives us an opportunity to consider that. Likewise, the government, the large part of that, maybe perhaps it might be Lucy will chip in something on this. I think there's a mix of different factors that the government use, and clearly on a weekly basis, I think they'll be reviewing whether or not we should move up. On the one hand, clearly these are restrictions. On the other hand, they are a measure of how well you're doing. And so we as a population, if we do everything we can, we then get the mark at the end of this week. You've done better. You've not done as well as you did last week. So the thing that's enforced upon us is the change of restrictions. We need to blast at this, irrespective of what category we are in at any point in time. We should probably behave now as if we are in a higher category at every opportunity. Do what you can to limit the risk of spreading the infection. In terms of the technicalities as when the government may or may not kick us up into another category, I think there's a range of things, including number of cases and infection rates. But I think it's considered as an overall consideration rather than a list of specific triggers. But a colleague might help answer anything I've missed on that one, possibly.
Thank you, Jonathan. Lucy, did you want to comment on that question?
Yeah, I'm happy to, and I know that there are other questions that have been submitted along a similar vein. So Joint Biosecurity Centre, Secretary of State, Chief Medical Officer have obviously looked at all of the variables that have played into different areas escalating over the last few months. And at the moment, the steer is that there are a number of variables that play into where the areas are escalated. As Jonathan's alluded to, that's about your crew case count, it's about your case rate, it's about the percentage of positive tests. So, a higher proportion of positivity, like we saw with Green Corps, is a real red flag. They look at the proportion of those cases that are aged 60 and over, because that obviously is a warning from a point of view of the likely translation into hospital admissions and hospital cases. Your relative risk of being admitted significantly goes up with age. They also, look at some of the softer variables about, is there political support for this move? Are all boroughs and districts wanting to do it at the same time? Because they're really keen to avoid confusion now. So areas moving together is easier from a point of view of communicating the restrictions, and also, if we're honest, easier from a point of view of enforcement as well. So, there is also reflections on, how well is the local situation being managed? Have they got a coherent response? Are all of the agencies involved in this speaking with one voice and acting together? So I wish it were as simple as there are specific thresholds that obviously that mean you automatically move between one level and the other. There aren't. It is a discussion at a local and then a regional and national level. We clearly have this press conference and we have the surveillance report and the Oversight and Engagement Board to facilitate those discussions. And, we continue to look at the balance of risk across the piece here and make decisions accordingly. But we are watching, with a keen eye what is happening elsewhere and the impact of the decisions that are being made in other areas.
Thank you very much, Lucy. Stuart, did you have a subsequent question, or am I?
Yeah, can I ask one other following question, if that's okay? Earlier on in this On Look East, we were looking at some councils saying they were concerned that in terms of student infections and student positive cases, that those cases were being allocated to the wrong area. So if a student lives in Northampton but then is studying up in Liverpool, rather than that case being recorded in Liverpool, it's being recorded in Northampton. I just wondered how much of an issue that was in Northamptonshire, with cases perhaps being allocated to our county when perhaps the infection has taken place elsewhere.
That's a very good question, Stuart. And in fact, we did discuss that this morning at the Oversight and Engagement Board. So I'm going to bring in Lucy to answer that. Although we do have Becky Bradshaw from the university, she may want to comment as well. But I'll bring in Lucy first.
Thank you, Councillor Morris. So we did this analysis on last week's data. As I'm sure you can appreciate it, it's quite a laborious process of going through and pulling out each occupation of a student to be able to then make the analysis against the line listing of cases. But on last week's data, so the 417 cases, we had around 50 cases that were identified as students and where there was potentially a second address that had been allocated. So as you say quite rightly, they may be attending university elsewhere, but their GP may have remained in Northampton and therefore the case has been allocated to Northamptonshire. So at that point you can see it's just under about an eighth of our cases. I think you've got to remember though that the equal and opposite is quite often true. So although we may have cases that have been allocated to Northamptonshire which actually may be residing elsewhere, we equally have students in our university who may have had a positive case actually allocated elsewhere as well. I'm pleased to say at the moment that although we may have had 50 students that actually may be residing elsewhere, we had a lot less than 50 students currently sitting at that point in Northampton University. So we haven't got to a net nil position, but we certainly are keeping an eye on it. At the moment, it doesn't affect our numbers to the point where it explains the sharp and steep increase, and therefore we must remember that it could be a little seen as a bit of a distraction from what is the core message here, which is our local cases are going up.
Thank you very much, Lucy, and thank you for that question, Stuart. I don't think I need to bring Becky in on that one because that was more of a technical question, but she is here if there are any university related questions. And thank you, Becky, as always, for joining us. Thank you for those questions, Stuart. I'm quite conscious of time, so I'd like to move on to Ben from Northants Live, Ben Waldron. It would appear that a lot of those questions that you have submitted have been answered, but I would like to give you a chance to ask another question if you wish to do so, Ben. Good afternoon.
Yeah, thank you very much. Yeah, I do realise a lot of it I think has been answered already. I think just the last one, I don't know if there is a hospital representative or not here, but I was just wondering what percentage of intensive care beds are currently available in our hospitals?
Yes, I was going to come. Yes, Ben, I was going to come to that one. It was the first three that I thought were dealt with. So thank you for that. I'll come to Simon. Simon, are you there?
Yes, thanks, Councillor Morris. It's Simon Welton. Just to introduce myself, my job title, I'm the Group Chief Executive of the Acute Hospitals, just for clarity, not from the CCG. So both hospitals have core and acute capacity in their ITU, but they've also now, as part of Wave 1, developed an ability to surge that ITU capacity in response to demand. So as we sit here today, KGH has a capacity to surge up to 29 beds in total if need be. And at the moment, we have 8 patients in those beds. So 7 non-COVID, 1 COVID. So 73% of our total capacity, core and surge, is available. In NGH in Northampton, we've got 16 and an opportunity to surge to 21 further, so making a total of 37. We've got 8 non-COVID patients in the hospital, in the ITU at the moment, 5 COVID. And so we've got 65% of the total ITU capacity, core and surge available, Ben. So hopefully that gives a good sense that we've got capacity to treat people if they need. We had that capacity throughout wave 1. Nobody who needed assisted respiratory intervention went without. I'd just like to take this opportunity to remind and emphasize the messages that Lucy and other colleagues have given. This is our opportunity to avoid further intervention, but we must all therefore, both in the hospitals and in our communities, adopt the social distancing guidance of hand, space and space. The other thing I'm particularly concerned about is making sure we all in the hospital get our flu jabs as well, because that's clearly another hugely important public health message that we can do to support those levels remaining manageable. I'll hand back to you, Ben, if you had anything to come back to me on that.
Thank you, Simon.
No,
I'm sorry I got your title wrong there, Simon. Sorry, Ben, apologies. I talked over you there.
No, don't worry. I was just thanking Simon for that. If I could just ask one quick question to Becky from the university. Just regarding the cases, obviously, in the report this week. Does she know how many students are self-isolated in halls as a result of these cases?
Thank you, Becky.
Of course, yes. So I don't have the number of students that are currently self-isolating in halls at the moment. So as you can see from the report, we're just reporting on positive case numbers. I think a lot of that is because we don't want there to be confusion between the level of actual cases that we've got and then the number of students that are isolating as well. So I'm sure you'll appreciate that a student accommodation is very different to home. So the moment you have one person that needs to isolate, you have many more then that need to isolate in that household. So no, I don't have the numbers at the present, Ben, I'm afraid.
Thank you, Becky. And I'm sure we can provide those as and when we do have them. Thank you for that. And thank you for that question. I'm going to move on to Alistair now. Alistair from the Chronicle and Echo. Hi, Alistair.
Good afternoon. Can you hear us?
Yep, can hear you. Welcome.
Yeah, thank you very much. I'm sorry, my question was to do with asking about a circuit breaker at half term, and that was the very first thing you said. So I'll ignore that question for now. Thank you. Instead, a question for Lucy. Lucy, when we spoke about 2 weeks ago, we did speak. Last week we talked about if the measures or the new measures released this week were not strong enough to bring our infection rate down, you would make it strong in your own terms. Have you considered this week putting Northamptonshire in tier 2 and applying to the government to send us straight into tier 2? Since a lot of these half-term measures are quite similar to what we see in tier 2 anyway. Have you considered just putting us in tier 2 and applying to the government? And if not, I guess why really?
Thank you, Alistair. I think we did allude to the answer. I think Jonathan and Lucy have probably already answered that, but I will give Lucy the chance to reiterate the thinking behind that.
Hi, thank you, Alistair. You're right. Obviously, the recommendations that we're making do tip into some of the actions that would be taken in tier 2. And that obviously is because of the steep and sharp increase that we've seen. The challenge here, as we've alluded to earlier, is yes, we people can obviously make a request to be escalated, but what we have seen previously when we've had 3 of our 7 boroughs and districts on the Chief Medical Officer's watch list, and unlike other areas, we have got all 3 of those patches off of that list, and that's down to the concerted efforts of our partners, but more importantly, the concerted efforts of the public. Them listening to the messaging, them taking what we're saying seriously and taking sensible and proactive steps around, those simple things, hand space, but also, as I said, the mixing of households where we've been able to give you information about what's driving the local case rates. people have responded accordingly to the recommendations to try and stop that onward transmission. We can see clearly now that this is around community transmission. So while we recognise there may be some limitations around isolation within a household, you know, again, please try your best. Between households is absolutely within our gift. So it alludes slightly to you know, your first question about did we feel at the point we had the first discussion, did we need a circuit breaker? At that point, our cases suggested not. We can see from the evidence now that actually limiting you know, transmission, communication, and contact between households could be one of those key factors to bending the trend locally. But we have to take into consideration the fact that we need to maintain our economy being open and supporting jobs locally, our schools remaining open, etc., for as long as possible. And again, just try and get that call to arms to the public and to rally around, to keep to those key messages, and to hopefully get us back into that space where we were a couple of weeks ago, where actually case rates were headed in the right direction. And we were able to obviously say with a little bit more confidence that we had got hold of the virus. We're not quite there at the moment, but I genuinely believe that we can still get there if we utilise half term, if we take sensible steps, and if we obviously keep lines of communication with the public open.
Thank you very much, Lucy. Alistair, I presume you're happy with that answer. So in which case, I will move on to Kevin Nichols. Kevin, are you there? I know this is a question for the police, but you may have another question. We don't have a police representative here today, but you may still want to answer the question. I don't know. Over to you, sir. Kevin.
No, thank you, Ian. I'd already noted there wasn't any.
Okay.
So
well, sorry.
Yeah, thanks, Ian. Just in the absence of a police contact, I know that was a really important thing last week, and I know particularly the Cron, how important it was. I mean, I can tell you that in the last week or so, at the Borough Council in Northampton Borough Council for sure, and probably others, we have been working closely with colleagues in the police, and we've been doing it to increase patrols, to check the bus queues and so on. Also working with colleagues at NCC, Public Transport Team, to progress a whole bunch of other actions to try and reduce the congestion in, for example, the drapery, which the area that the Cron particularly mentioned. Apart from that, also, I know that our office has been in touch with Stagecoach and working closely with them to try and check some practicalities of even moving bus stops possibly out of the drapery, which is rather congested. So although I haven't got a police update, I can say that there's stuff happening on that's hopefully to better reassure you a bit, Kevin. Thanks, Ian.
Thank you very much, Jonathan, and thank you for the question, Kevin. That was a very good question.
Yeah, very welcome. I didn't even have to ask it.
No, you didn't. It's brilliant. Thank you. That's with the better telepathy between question asker and answer is always very good. So we're going to come now to some. You very kindly, the Chronicle and Echo did ask some questions of their readers for us to ask, and thank you for that, and thank you for the readers for submitting those questions. The first question is around why is Northamptonshire in the lowest tier given the recent increase in cases? I think we may have already answered that, but I don't want to necessarily belittle the question from a member of the public. So I would perhaps give Lucy another chance to answer that question, bearing in mind it is from one of the people we're trying to reach so desperately to get these numbers down. Lucy. Has Lucy gone? We seem to have lost Lucy. Jonathan, are you still there?
Yes, I'm with you.
Okay,
yep.
Perfect, right. There was me thinking I would lose my internet, but it seems that Lucy's lost hers. So, the second question was, the first person to sadly die at NGH while testing positive for COVID-19 in 73 days happened this week. But more and more people have been testing positive during that time. Does this mean the virus is losing strength, or are we getting better at treating it? A very good question, and thank you to the reader who's posed that. It's really heartening to know that members of the public are engaging with this subject. So I'm going to bring in two people on that. I've got Simon Weldon again, and Joe Watt. Simon, did you want to go first, and then I'll bring in Joe? Simon.
Thanks. So the first thing to say is yes, we have had deaths in both hospitals over the last week, and the reader is quite right to point out that's the first time in a while that that's happened, and again should make us all pause and reflect about the fact that inevitably when community transmission increases, sooner or later that will pass into the hospitals, and sooner or later that will result in, sadly, people passing away. And I'd just like, again, on behalf of the hospitals, to say every one of those deaths I fully recognise is an irredeemable tragedy for the family and the loved ones of the people involved, and to pass on my condolences for all of those losses. We know, we feel those losses, and we try and do all we can to help support people in those situations. So the virus is not obviously getting weaker. It is still out there, and we are still waiting for the definitive treatments to really, a vaccine to really make the difference that we need. And I'll invite Joe to comment on that in a minute from a GP's perspective. We have learned huge amounts about the virus, and since the first wave, we have got better at treating the illness. That does not mean it is not an incredibly serious issue for people. It does not mean it is not an incredibly serious disease of old age. And going back to what I said earlier, I worry very much for people who are vulnerable and potentially get flu, and the consequences that could have for them clinically if they arrive in our hospitals. So we are getting better at treating it. We still do not have definitive treatments available that will absolutely be the cure that I know everybody is looking for. And we continue in Northamptonshire, as in many other hospitals up and down the country, to be part of those research trials, helping to look for that answer. But I'll hand over to Joe to talk about the issue from a GP's perspective.
Thank you very much, Simon. Joe, welcome.
Thank you. Thank you, Simon. I think you're absolutely right. There's a whole spread of cases, and I think it's important to recognise that many of the community cases that are testing positive now, we were not able to detect those cases earlier on in the pandemic. We didn't have the community testing, and I still don't think we have detected the full range of people in the community who are suffering from COVID. As a GP, I have people who are reluctant to test, so they have a cough and they say things to me like, but I'd know it was COVID. They wouldn't. We aren't detecting all of it. It's really important, if you think you may have COVID, you must self-isolate, only leave the house to get a test, and then stay away from people. We do hear of people who either keep going to work when they have mild symptoms, or who don't think that they need to be tested. You would not know it was COVID without getting a test. So it's really important to identify when you have those symptoms. We are detecting more. The difficulty we have is that we don't know who is going to get the more serious form and who that person might pass it on to. And it's very much about protecting the people around you. So if you have symptoms, do not mix with anybody else. Do self-isolate immediately. You may not be vulnerable, but the people around you are going to be extremely vulnerable. And one of those people may unfortunately become unwell enough to be admitted to hospital or even intensive care. So it's really important to limit the spread, get yourself tested, adhere to the advice. But there is a lot more out there in the community. These are not cases we were able to detect the first time around. This gives us a golden opportunity to limit the spread. And if there is any possibility of being infected, please self-isolate, do not mix with other people, and we can try and contain this, and hopefully people will not become unwell enough to require the hospital services.
Thank you very much. Thank you very much, Joe and Simon. Very, very thorough responses. Thank you. And thank you to the reader that put that question forward. Very, very good question. I see Lucy's rejoined us. Welcome back, Lucy. Sorry about the gremlins in the system. I believe you're back. Yes.
Hi. 4 o'clock every Friday, it seems to throw me out, so apologies for that.
I know, it's almost like clockwork. I don't quite know what happened. Somebody didn't put the money in the meter again, I guess. But I was going to come back to you. Thank you, Simon. We've moved on a bit, so we're going to go back to that first question that I know we've already answered it, but I think it's important to reiterate it as a reader has asked it. So it's why are we in the lowest tier given the recent increase in cases? I think it's important that we answer the question. Thank you, Lucy.
Yeah, absolutely. And I'll do my best because, as I said, there are no clear thresholds, if we're completely honest, that have been outlined by government for each of the levels. But I think the reason that we're in the lowest is obviously one, if you compare our rates to other areas, we are at the lower end of the spectrum. Now, as I've said before, being the best of a bad bunch is not good enough for me, and it's not good enough for the local residents. So this is about, trying to take early action so that we can not just maintain our position, because it clearly is escalating and escalating quickly, but even improve our position. And I think the second element is we're almost a victim of our own success here. So, we demonstrated that working together, public agencies, we can, turn trends around. So had we, been in the position that we were a few weeks ago, months ago, where we were on the Chief Medical Officer's watch list, that was compared to other areas, we were high. Our attack on that position, the increased number of tests so that we knew where COVID was, the adherence to the isolation requirements and requests, the reduction in household mixing, etc., that we saw there, that response from the public got us to the good place that we were in a few weeks ago, where we could come off the Chief Medical Officer's watch list. And that is the bit that at the moment is, keeping us where we are and riding in part some of the decision making around do we or don't we request to be escalated, is we know we can do this. We know that we've got influence over some of this locally. So let's try and utilise all of the actions that we did previously. And as I said, either maintain or improve our position. But at the moment, it's the fact that compared to other areas, we may look better, but it's still not good enough.
Thank you very much, Lucy. Very well put. We've got one more reader question. I know we're at 4 o'clock, and then we've got one other question from Neil Barber. So I will ask this final question because, as I say, it is from a reader, and it's great that we engage with them. So it was, what would you say to people who ask, why are we making the restrictions we are when the infection rate is still a very small percentage of Northampton's population? Now, it may be that Jonathan may want to come in on that, and Joe Watt may want to come in on that as well. Joe, did you want to come in first on that?
Yeah. Yes, thank you, Councillor Morris. So I think it's probably fair to say we probably haven't detected all of the COVID that is out there, and I think it's about acting early, getting tested and making sure that we limit the spread as well. It is about complying to make sure that we protect our community. It would be really good to see those rates drop, and I think if we can adhere to the guidance that we've been given, I think we can get those levels to drop. But there is more out there, so it's really important that we don't do things just because we can, to echo Lucy's words, to try and limit our social contact and make sure that we comply. We do not want those rates rising. Even one person being admitted to hospital, becoming unwell or ending up in intensive care, that is one person too many. That is somebody's life, that is somebody's family. These are our families and friends in our community. So we really need to work to protect the people in our community. We can do this if we do it together, but even a small rate is too many. We need to look after each other, and this is our opportunity to do that.
Thank you very much, Joe. Very well put, I have to say. Jonathan, you wanted to come in quickly on that one as well.
Yeah, thanks, Ian. I think I'd make 2 points. First of all, that hints at, perhaps this whole feeling of proportionality, and back to what I was saying about the balance between health, which I think is our overriding primary concern, but also balancing people's liberty along with the economy and so on. And I think that reader is asking around that whole issue and that huge challenge. Which I think is why a big part of why we haven't ultimately said we are pushing to be on tier 2, but we know there's a good chance of heading that way. I suppose the only thing I would say is this: there may be a very small percentage of Northampton's population who is infected, but my own view is that every single one of us is at risk, and perhaps that's the most important thing to draw out of that question. Thanks, Ian.
Thank you very much, and we would all agree with you on that. Absolutely. I've got Neil Barber from ITV Anglia now. Hi, Neil. You've been very patient. Good afternoon.
Hi there. Can I just ask just quickly, Lucy, would you mind just turning your phone on its side so that we get you full frame? Is that all right? Yeah, sorry. Yeah, just it's clearer when it sort of pops up on telly. Perfect, brilliant. First questions to you, Lucy. You said to me earlier this week that you were going to look at the tier 1 restrictions and in a week's time see how much effect they'd had. This morning you also said that the county is about 3 weeks behind places in the north, which obviously we're seeing rates skyrocketing. Realistically, how long have you got to turn this around? And also I noticed the rates being so different across the county. Would it be beneficial to say to people, for instance, from East Northamptonshire, if they're being asked to go into work in Northampton, they shouldn't? And also, I just want to check, Jonathan, you, again, earlier this week told me that you weren't ready to argue for a change to tier 2. When will you be?
Thank you, Neil. Lucy first, and then Jonathan. Very good questions, Neil. Thank you.
We've alluded to the complexity of any of the decision making around the tiers. This is absolutely something that we want to do as a county. We're clear that although the rates may vary between different areas, this is now affecting Northamptonshire in a way that it hasn't before. There are not the significantly different pockets. And as I said, it's not focused on our more densely populated areas. It is not focused on our more deprived areas. COVID is now across the county, and it is a county-wide issue. It is affecting every age group, and it is now translating into hospital admissions and sadly deaths. So we want to be absolutely clear that if and when we were to request an increase in our status, it would be collectively, and it would be with full consideration of the economic impact, the impact on education, the impact on jobs, the impact on our high streets, the impact on people's mental health. This is, equally challenging when further restrictions are introduced. I am uncomfortable with where we are as a system at the moment from a point of view of our rates, but we have to balance all of those different risks when we come to a decision. And it will be a collective decision with political support, with NHS support, etc. when we do so. So we are monitoring the numbers closely. We are having that discussion on a regular basis, and we'll continue to do so in response to the data. And we continue to have those discussions as well with the Joint Biosecurity Centre, with Public Health England, and take their advice. And if and when we do get moved up, be that out of choice or be that because the government feel that they need to intervene, we will make sure that we stand shoulder to shoulder on the decision making and the implementation of the actions thereafter. But as I said, the one thing that we do know is that Northamptonshire residents rise to a challenge, and that's the bit that we want to see if we can indeed utilise perhaps the couple of weeks that we may have between now and the trend that we've seen elsewhere to intervene. There is an opportunity here. We need to make sure that we take it.
Thank you very much, Lucy. But very, very good answer there. Jonathan.
Yeah, thanks, Ian. Yeah, interesting, Neil. We discussed this only a couple of days ago. Since, I've thought really carefully about this, given it a huge amount of thought, which again fed into, as all my colleagues did, the discussion, the decision we made at the COVID Oversight Board this morning. In terms of when would I be ready to argue for tier 2, I think there's probably 3 things I'd say. One, first of all, actually, I'm not ultimately sure now is the time to judge. We're dealing with such a varied and dynamic situation. If we had just one factor to measure this by, then we could set a threshold, couldn't we? And perhaps it would be nice if it was a numeric one. But actually, when you take into account things like the rates and the cases and so on, and then you take into account other factors that would impact, such as the hospitalisation, which may become a serious factor if we find the hospitals are increasingly occupied, then you've got issues like outbreaks. There are so many layers to this. It's the most complicated different thing rather than something you can measure by one single threshold. And it could be that we would set a target for a threshold and then find that actually we should make that decision even if we haven't reached the threshold, because so many other factors are looking far more far more critical. So it's really difficult to do that. I'm never going to rule it out. And if it seems to be the right thing for Northampton and Northamptonshire, I will absolutely go into bat as strongly as anybody else to make sure to do that. And I know that colleagues would support me. I'm also mindful, of course, that this is an active, an active dynamic situation, which the government are also actively monitoring. And I know that through professionals like Lucy and so on, there is an active dialogue with government. So we shouldn't necessarily assume that the first move would be ours. It's very possible that we would come to the same conclusion at the same time as the government, because we've got that ongoing dialogue, I think. Thanks, Ian.
Thank you very much, Jonathan, and very good indication of all the teamwork that goes behind all these decisions. And the board itself, the oversight board, as you've said, is just one piece of the jigsaw that makes up that decision. But it's certainly a very much a joint approach across the board, as you can see from the people who attend these meetings. It's not about parties. It's not about who we work for. It's purely about getting the right solution for Northamptonshire, and I think that's going to remain the case for some time. And obviously, we, as you've already said, Jonathan, we meet weekly for the board, and no doubt the position may change before then or by then, but we'll go as we go along, and with all the advice from Lucy, etc. Did anyone else have any further questions? I can't actually see any hands up. In which case, I'm sorry, we ran over very slightly there today, but I think that was very important that we covered all those questions. So I will close the meeting today. Thank you very much for attending, as always. Thank you very much for the questions, particularly the ones from the members of the public, which I think are heartening to see, and all the people who answered the questions, and our officers and all the attendees. Can I wish you all a very happy weekend? Stay safe. Let's follow the guidance, and together we can all beat this virus in Northamptonshire and across the country. Good afternoon.
Thank you, Ian. Thank you.